Hello everyone. Today, I'm here to tell you about our solution to effectively treat sinusitis with a completely new approach to what we already know. First of all, let me introduce myself. I am Sandro Soriano. I am 50 years old and I am a director and researcher at Nevia Biotech, a pharmaceutical company focused mainly on the development and production of innovative pharmaceutical products for the upper respiratory tract. For about 20 years, I have been involved in research and development of products for the treatment of common respiratory conditions, especially sinusitis. Before talking about our product to effectively treat sinusitis, I would like to make some considerations with you. Sinusitis sufferers usually suffer from it for years without being able to resolve it, even having 3, 4, 5 flare-ups a year. While the feedback we get from people who suffer from sinusitis confirms that they have been suffering from it for 5, 10, even 20 years, we also have a lot of feedback confirming that there are many products on the market, pharmaceutical and otherwise, that manage to treat sinusitis more or less effectively. If this is true, why do almost all of the people who write to us claim to have been suffering from sinusitis for many years? The answer to this question is very simple. Probably the products currently on the market do not act on the real causes of sinusitis symptoms, therefore sinusitis. But what are the real causes of sinusitis symptoms? To answer this question, it is necessary to know a little about the upper respiratory system and the reasons that trigger sinusitis. First, let's focus attention on the part of the body affected by sinusitis, or rather rhinosinusitis. We all know that sinusitis is a pathological condition affecting the upper respiratory system. The upper respiratory system affected by sinusitis is essentially composed of 3 parts: the nasal cavity, paranasal sinus ostia, and paranasal sinuses. To better understand what the upper respiratory system looks like where sinusitis creeps in, let's imagine that the nose is a water faucet. This tap is connected to many reservoirs by pipes of different diameters, where the reservoirs represent the paranasal sinuses and the pipes represent the ostia of the paranasal sinuses that connect the tap to the sinuses. In our upper respiratory system, there are several reservoirs, then several paranasal sinuses. Each is connected to the tap, then to the nose, through a small tube called paranasal sinus ostia. Specifically, we have 2 maxillary sinuses just above the cheeks, 2 frontal sinuses above the brow arches, and 1 or 2 sphenoidal sinuses that are located in the center of the skull, just behind the nose, and several small ethmoidal sinuses located around the eyes on the side of the nose. Each individual reservoir, thus each individual paranasal sinus, is connected to the nose by a tube called an ostium, which is more or less small in diameter. When the smaller the tank, the narrower the diameter of the tube connecting it to the nose. What do we need to know that is important about this particular water system, namely the upper respiratory system? Both the faucet and the tanks and their connecting pipes are lined with a mucous membrane, that is, a kind of spongy mat that has many tiny brushes on its surface, indeed tiny brushes that cannot even be seen with the naked eye. This spongy mat lines the entire water system and is connected to the central nervous system through nerve fibers that we will call rubber bands. An important peculiarity of this mat is that it produces mucus, a substance composed of 2 layers, a more watery one in contact with the outer surface of the mat until the brushes are almost entirely covered, and a thicker layer positioned above the accused one where the brush tips are slightly immersed. The mucous brush system is called mucociliary tissue. What is the function of this mucociliary tissue? First and foremost, carry the mucus outward, along with any infectious substances or agents that enter through the nose when we breathe. Second, temper the area we inhale by heating or cooling it as appropriate. Third, to prevent pathogens from adhering to the carpet, then adhering to the mucosa and penetrating into it. That is within the tissues and therefore within our body. These functions are really important because they safeguard us from infections of pathogens. So if this system is not working well, our body is at risk. And for what we are interested in here, you can trigger sinusitis. Let's take a small step back. That is, let us return to our hydraulic system for a moment. In the absence of pathological situations, within this system circulates freely the area we inspire from the nose. And at the same time, outflows mucus produced by the mucosa, lining the reservoirs, tubes, and then paranasal sinuses, ostia of the paranasal sinuses, and nasal cavity. In many reservoirs, then in many paranasal sinuses, the tubes that connect them to the nose are located at the top of the reservoir, not at the bottom. So in order for mucus to leave the reservoirs, it must first go up the walls of the same reservoir and then pass inside the tubes and arrive at the faucet, then the nose to be evacuated. How does the mucus get up along the walls of the tank? It's so simple. It does it through the very carpet brushes we mentioned earlier. So let's fix an important first point right away. If the brushes fail for any reason, the mucus could never get out of the tanks. Let's go back for a moment more to the spongy carpet that lines our aerolic plumbing system. Yes, that's right, system that carries both liquids but also air. Why did we call this carpet spongy? Because when this tissue becomes inflamed, i.e., triggers an inflammatory process that can result from multiple factors, this one fills with fluid and swells just like it is a sponge. Let us now imagine that for a trivial cold that goes on for more than 5-7 days, the mucous membrane lining the tubes becomes inflamed. What happens? What happens is that the spongy mat fills with liquid and swells up until the lumen of the same tube is almost or totally occluded. If this occlusion does not resolve spontaneously within a short time, 1 or 2 days at most, in some cases even within a few hours, sinusitis is inevitably triggered. Let's see how. We mentioned that the small pipes that connect the faucet to the tanks are clogged there. What does this entail? It entails that the air inspired by the nose can no longer get into the sinuses, and the mucus that is produced in the reservoirs connected by the plug tube can no longer get out, so it gets trapped inside the same reservoirs and accumulates until it fills them up even completely. Let's take one more small step back, that is, to when the tubes have just become clogged. We have said that air can no longer get inside the reservoirs, but what happens to the air that has been trapped inside the reservoirs themselves, thus in the sinuses? This is absorbed by the blood vessels of the mucosa, i.e., our spongy carpet, creating a negative pressure within the paranasal sinuses. This negative pressure stresses the nerve endings, i.e., our springs that connect the mucosa to the central nervous system, and we begin to experience pain at the affected sinus. This is the beginning of classic sinusitis pain. In fact, the trouble is not over yet, because if in the meantime the small tube has not reopened, as we mentioned earlier, the reservoir begins to fill with mucus, which with its weight and volume stresses the springs even more. Thus the nerve endings generating a positive pressure inside the paranasal sinuses. This accentuates the pain, which can also become very severe. This is the real cause of facial pain. In the jargon, craniofacial algia from sinusitis. How to make the pain disappear? The only way to make the pain go away is to reopen that clogged tube or tubes, because there may be more than one. This is to get the air back inside the reservoir and at the same time get the mucus that has accumulated in the sinus out. What needs to be done to get that tube reopened? It is necessary to drain the fluids that cause the spongy tissue, i.e., the mucus lining the ostium of the affected sinuses, to swell. Here is one of the peculiarities of our product that I will tell you about in detail later. It is to act directly on the edema of the spongy tissue by making it drain all the fluid that keeps it swollen and thus allowing the tubes to reopen. As soon as the tubes have reopened, air can again enter the reservoirs and mucus can again exit the same reservoirs and be expelled through the nose or throat. As soon as the air re-enters the reservoirs, normal pressure will be restored, and as if by magic, the pain will disappear. At this point, you will ask yourself, everything solved? Actually, not really, because it is true that the tubes have reopened and the pain, the severe one, is gone, but there is still a very important problem to be solved. The problem that makes chronic sinusitis. That is the accumulation of mucus pus in the reservoirs. Therefore, in the paranasal sinuses. At this point, you may wonder how the mucus in the reservoirs became infected if the tube connecting them to the faucet is obstructed. The answer is very simple. Viruses, bacteria, fungi that enter through the nose can pass through the small tubes even if the tubes are closed. These pathogens, once they enter the reservoirs, begin to proliferate because they find an excellent substrate for their growth, namely mucus produced by the mucosa. This is how mucus pus forms and accumulates in the paranasal sinuses. From an infectious point of view, when mucus stagnates in the reservoirs, trouble can still escalate, because if this mucus pus does not come out quickly, the infection can spread beyond the sinuses and infect other nearby tissues and organs, including the brain, in very rare cases, fortunately. At this point, you may ask now, what could happen that would be more serious for my sinusitis? Actually, a few other things can happen, indeed inevitably happen, that can lead to chronic sinusitis. What are they? First, when a mucus pus is trapped inside the reservoirs for a long time, weeks, months, but also years, in addition to pain, to the infectious problem is added the production of a myriad of pro-inflammatory substances with strong hyperalgic potential, i.e., irritants, produced by some cells already present in the mucosa called mast cells, or even coming from the marrow. And they are called eosinophils. These substances trigger a chronic inflammatory process that causes our spongy tissue, then mucosa, to remain constantly inflamed and edematous, then full of fluid, contributing to keeping the paranasal sinuses ostia obstructed. 2. The mucus that has accumulated in the reservoirs, which at some point may even become almost solid, crushes and traps the brushes of the spongy tissue, i.e., the cilia of the mucous membrane ciliate cells, preventing them from performing their function of transporting mucus toward the nose, i.e., outward. This function of the brushes we call ciliary mobility. This is not the end of the story. After a while, that inflammation persists in the sinuses and ostia. Then in the reservoirs and tubes, the brushes lose their full brushing ability, i.e., they slow down or even stop their movement. so they can no longer transport mucus outward, which gets trapped in the reservoirs, then in the sinuses. We call this function ciliary motility. Let's take stock of what we have said so far. First, a trivial cold that lasts for more than 5-7 days or even other causes that we will see later produces inflammation that causes the spongy tissue, then the mucosa, to swell in both the nose and the ostia and paranasal sinuses. This is the formation of edema. 2. The swelling of the mucosa inside the tubes clogs them, and air can no longer enter the tanks. Negative pressure is created inside the tanks and pain is felt. 3. With clogged tubes, mucus accumulates inside the reservoirs, which then becomes infected. This mucus can no longer get out and accumulates until it fills the reservoirs. This is the accumulation of the mucus pus. A positive pressure is created inside the reservoirs, and the pain is accentuated. 4. When mucus stagnates for a long time inside the reservoirs, it becomes solid and heavy, to the point of trapping the spongy tissue brushes that can no longer move. This is the loss of ciliary mobility. 5th, the infected mucus within the reservoirs becomes filled with inflammatory irritants. These substances feed an inflammatory process in the spongy tissue that continues over time. This situation results in the loss of the ability of the brushes to move. We call this a reduction or arrest of ciliary mobility. What has been said so far shows that sinusitis is not a trivial condition, just as treating it is by no means a simple matter. In fact, to treat it, it is necessary to use a product capable of acting effectively on all the true causes of sinusitis symptoms described so far. We at Navia Biotech have formulated a simple nasal spray capable of acting effectively on all 3 true causes of sinusitis symptoms. The nasal spray is called CILIACELL and can be purchased online at our website, on Amazon, or at pharmacies. How our CILIACELL works and why we consider it so effective, I will reveal in the next video. In the meantime, you can already visit our website for all the relevant information, where you will also find all the FAQs about the product. Thank you all for your attention, and see you next time.